Very good morning to all those who have joined. Uh, Before we formally start the program, just a few uh, points to remember for all our attendees for today. Requesting all to please keep your mics muted throughout the technical session so that there's no chaos created while the technical session is going on. You any questions or queries that you have, you can drop it in the chat box. By the end of the technical session, we will have a Q&A where me or somebody from my team will read out the questions that are there. Both AFSTI and CSMB teams are here to help you. So any doubts that you have or any help that you need regarding the application too, you can drop it in the chat box and we'll help you out through the chat box. Besides that, please avoid dropping out from the session frequently, as you know, this is a certified program. Any student who attends 6 or more sessions will be certified through this series. So we do record the attendance, and your participation will also be considered through the feedback forms that you submit. So by the end of the session, there will be a feedback form link that will be provided in the chat box. Please do make sure that you fill it up so that we are able to track your presence in the during the sessions. I hope all have a wonderful session. We'll start at 10:35 sharp.
We should start, Samisha.
Yes. Very good morning to one and all. I welcome all of you for this edu series organized by FSTI Mumbai chapter, supported by the Chamber for Advancement of Small and Medium Businesses, CSMB. It is our honor to initiate a series of such cadre for all the budding food technologists, food scientists in our fraternity called the Food Techie Sherpa. This is the second session in this series, which is more from a food regulatory point of view and global technological requirements point of view. I will, as we initiate the session, I will request Mr. Ritesh Mathur, Vice President, AFSTI Mumbai chapter, sir, to please deliver the welcome address for today's session and to brief the students on how and why we started this series. Over to you, sir.
Okay. Thank you, Samisha. Uh, Welcome everyone. Welcome to the session of the Food Tech Sherpa. We started this edu series for all the young entrepreneur, for all students who want to understand more about the food. And we are going ahead of the academic things what you learn in your school and colleges. We are going beyond that and talking about the new emerging topics. Like last time we discussed about the culture meat, like this time we're talking about the comment of the food emerging preparedness. So we are going the way ahead, and which can really help you, or will give you knowledge about upcoming things in the food. Right? That's what the whole idea of the event. This particular the series is a joint effort by both FST and CSMB. So take full advantage of that. And I'm not sure how many of the new to the this series. But if anyone new, I just want to take couple of minutes to talk you about the AFST and the CSMB. I'm sure many of you might have heard of it. In case if someone doesn't know, like it'll good to learn them, know them. So AFST is basically called Association of Food Scientists and Technologists India, and we are from the Mumbai chapter. So it's a premier food professional organization of India, which represent more than 50% pool of the food scientists and technologists. Okay, and this is one of the largest profession and education organization in India. FST has a headquarter at CSR CFTRI Mysuru, and we have different chapters across India, and we being leading at the Mumbai chapter. We basically lies between industry, academia, regulatory, students, everyone come out of one place, and we talk about good about the food industry, or a student who can talk about food, regulatory, connect everybody, and ensure it's a good ecosystem on the food. Okay. If you're not a member, please become a member. Anyone who is of degree in food, science, and technology and allied, food, nutrition, food, biotechnology, chemical engineering can be become member of the AFST. So in case you're not a member, please join. Okay. The second partner for us is called CASMB, which Samisha mentioned. It's known for Chamber for Advancement of Small and Medium Businesses. As they mentioned, they work very closely with the micro, small, and medium businesses. And they support academic research, advanced technology, government schemes, policies, and benefit to SMEs. So anyone who want to do something in the food or food allied thing, they are the right people who can connect you. And they also do like a capacity building through training and development, which is a part of initiative of this particular series. Okay, so we do a lot of such events, and please check our social media post or our emails, and we are very active in this domain. Okay, so good. Quickly, I'm just going through today's session. Moving ahead. So, should I introduce Vikas ji, if you allow me?
Please, sir, please.
Yes.
So nice
Yes.
of you, sir.
Super. So Vikas ji, Vikas sir is an agriculture graduate, gold medalist, and does his MBA in international business and marketing. He's also like a postgraduate from the Israel from Hebrew University. Sir has 15 years of experience in government and various capacities, right from regulatory director to in FSSAI and regulatory and compliances. Sir also worked at the Food Corporation of India. Sir was also point of contact for FAWHO in Southeast Asia from India and developing clean and safe tradition food markets. Sir has a subject matter expert, is an SME for the food safety, compliances, legal matters, enforcement, food safety, emergencies, responses and incidents, food recall, licensing, regulatories, industry engagements, member task force. He's a member task force for Indian traditional sweets and savories, like clean fruits and vegetables. So whatever you heard today, like I'm sure you hearing the news about the spice industries thing or other things and compliances part. And sir is the person who can literally talk about all those things or emerging issues happening in the food industry. Right. Sir is currently working with as a associate director in regulatory affairs with CanView, which known as a J&J, which all we all know pretty well. And even I know a J&J pretty well. Than the new name can be. So I request sir to take this session on this. And sir, we're looking forward to hear more from you about this, about the new technologies or the world technology requirement for the food imagining and preparedness. So welcome, sir. Welcome on the board and welcome and looking forward to hear from you, sir. Thank you, sir.
Thank you, Ritesh ji. Thank you. Samiksha, shall we start?
Yeah. Samisha, yeah. I mean, there's some requests for everybody just to keep their keep their system on mute, so we can hear the our speakers. Okay. If any questions
Yeah.
you have, you can ask in the last. Yes, Samisha, go ahead.
Yes. Thank you, Ritesh sir. Vikas sir, stop the screen share. You can now share your screen. While sir does that, I'll just quickly repeat the session etiquettes for all our newly joined attendees. Uh, Requesting all to please keep your mics muted at all times during the technical session in order to avoid any chaotic situations. Also, as you know, this is a certified training for anyone who attends the training for more than 6 sessions. So please make sure that you stay you stay present in the session throughout, and avoid dropping out frequently, so that make sure your network is better. Also, we will be circulating a feedback form at the end of the session. Make sure that you fill it so that we can mark your presence in the session. In case of any doubts and queries that you have, the chat box is open and our team will be happy to address any queries that are there by the end of the session. With that, I think we are, without any further ado, I request Vikasa to please continue with that session.
Thank you, Samiksha. I hope my screen is visible.
Yes, sir.
Yeah, great. First of all, I would like to extend my thanks to AFSTI and CSMB for choosing this very pertinent, I think, most relevant topic of the time, because we are seeing that how country is facing bombardment of allegations or charges related to the presence of ethylene oxide, and how every citizen is almost very concerned about the safety of spices and other things also. So our topic of the day is very relevant and very pertinent, but at the same time I must admit that it is quite neglected and often overlooked topic, not only in India but across the world. Basically, there are various reasons. One is obviously the lack of awareness about such things. Another thing is that when we come across food safety and food security, so obviously food security takes precedence over food safety. So that's why WHO and FAO together in 2004 only, means around 2 decades back, and they constituted a special body among at their headquarters in Geneva only, which is called Infosan, which we will discuss in detail during the course of the session. So we will realize how important this topic is for everyone. And as the opening page shows, food safety is everyone's business. So it is our shared responsibility. And let's go and see what does food emergency preparedness means, and how we can relate to it as food technologists or food scientists. So first of all, there are certain definitions. As you can see from the pyramid, the responses or the scale of response differs from the situation. One thing is that at the bottom is that there is a business as usual, then there is incident, then emergency, and then crisis. This pyramid has been defined or has been given by the codex also. So first of all, there are food safety incidents, any situation within the food supply chain where there is a risk, potential or perceived. So here, colleagues, I would like to highlight the key term here is potential risk or perceived risk. So it is not always that there should be a risk, actual risk should be there. Sometimes it is the there is some risk, or the consumer perceives that there is some risk, we need to manage such situations also, because it is not, especially in case of contaminants, it is not always that there is an actual risk or a demonstrable risk, but yes, still public perceives that there is a risk, so we need to cater to such situations also. Then Codex Alimentarius Commission defines food safety emergency as a situation, whether accidental or intentional, that is identified by a competent authority as constituting a serious risk and as yet uncontrolled foodborne risk to the public health that requires urgent action. So there are certain elements in this definition. One of the key element is that it is an uncontrolled foodborne risk. So when the risk has gone or has grown in an uncontrolled manner, it becomes an emergency situation. And then it is also related to national food system or national food regulatory system also. That is why there is a term called competent authority. So every country has slightly differing or slightly different food safety or food control systems. So in India, this competent authority is the food authority, that is Food Safety Standard Authority of India. Then sometimes we tend to confuse these terms or these definitions with the foodborne outbreak also. This has also been tightly defined. The observed number of cases of a particular illness that may be foodborne exceeds the expected number, or the occurrence of two or more cases of a similar foodborne illness resulting from the ingestion of a common food, and epidemiological analysis implications the food as the source of the illness. So here we can see there should be at least two cases of which has arisen from the consumption of the same food, and there should be epidemiological analysis also. So it is not only that we need to analyze from the perspective of what you say clinical implication, but we need to analyze in such scenarios from the epidemiological perspective also. Then here, what is food safety emergency response? Here I have broken the definition in, or I have split the definition into parts. Food safety emergency response is a process of assessing the risk, making the risk management decisions, and communicating the risk. So if you see that it is somewhat related to risk management principles. First principle is assessing the risk, another is managing the risk, and then communicating the risk. All three components are equally important in the face of time constraint and often incomplete data and knowledge. So if you can correlate with the news, or if you are quite aware about the recent ethylene oxide incident and I know that many of you will be curiously following this. So if you can see, then the all three elements and the bottom red disclaimer basically are very pertinent to the current scenario. Means there is a requirement for assessing the risk, making the risk management decision, and above all communicating the risk. So this communication is also important to communicate or to build confidence among the public. Sudden news or sudden a single item of news, if analyzed in an isolated manner, leads to panic kind of situation or risk mongering or the scaremongering among the public. So communicating the risk science through science-based analysis, and often you can understand that there is incomplete data and knowledge. It is not that you know the entire universe. Sometimes there is a sketchy information available, but still, instead of outrightly denying or accepting such situations, we need to as a student of food technology or as food scientist, we need to analyze such situation in a scientific manner, following the principle of risk management. If we follow the sound principles, then easily we can convey our stance or our findings in a confident manner to the public and other stakeholders, in fact to the international community also. Then this is a networking of all structural component of food safety emergency response system. You can see that it is a multi-sectoral approach, because students might be aware of One Health concept. Now the One Health concept adopts an integrated approach. So we will also see later on how this is relevant to food safety emergency response. But you can here see that the cardinal point here is the national emergency contact point, which is basically with the Food Safety Standard Authority of India. I have been national emergency contact point for India for last 3 years. So this is the person who receives all the communications from various authorities and coordinates with other bodies. So here you can see that it is basically there are two important communities. One is committees. One is Food Safety Risk Assessment Committee. Another is Food Safety Coordination Committee. Now these are two significant committees. Rest there are participant bodies. One of them is the NCDC, National Center for Disease Control. So that is there because if you can see, um, every illness has two aspects, or two, in fact, three aspects. One is purely administrative aspect, that is to
टीवी कर लो
manage
थोड़ा,
or to
टीवी करो,
enforce regulations or to law.
सुनाई नहीं देता है, टीवी करो.
Another one is the clinical, means someone consumed or some people consumed contaminated food and they got ill, and the doctor or general physician came and cured them, gave them medicines. This is purely clinical. Third one is epidemiological. There could be different factors which lead to such kind of situation. So we need to have a very strong and multidimensional approach towards them from all angles. Then only we can have a sound food safety emergency response system in the country. So you can see NCDC is there, state food authorities are also there, foodborne illnesses, other food safety incidents like allergens, adulteration, in fact contamination, then other national focal points, ministries, export inspection councils, APIDA, consumers, etc. Then there at the back of the this InfoSan Secretariat from Geneva also communicates with National Emergency Contact Point. Then there is there is appropriate response. Food Safety Coordination Committee basically coordinates with the all the architecture that we are seeing, because as you can see, it is a multi-level, multi-sectorial approach. So there should be one body who can coordinate among all these entities. Then there is a Food Safety Risk Assessment Committee. Its role is very critical because it is the scientific backbone in a country that who can analyze whether the risk is actual risk or a perceived risk. In case it is an actual risk, what is the threshold level beyond which it can be declared an emergency, or beyond or less than which it can be declared just a risk but not an emergency situation. Then this is at domestic level. If we trifurcate it, it leads to health sector, food sector, other key relevant partners. So you can see that One Health is deeply embedded in the food safety emergency response system. Health sector includes local health authorities, rapid response team under NCDC, national focal point. Now, this national focal point basically leads to the clinical investigation of the disease. Then in food sector, there are food safety authorities, because we have a federal architecture. So we have at the central or apex level, we have food authority, food safety standard authority of India. Then in every state or union territory, we have state food authorities. So these, there are then other relevant key partners. There are EPIDA, EIC. Now, if you see on the top, there are foodborne illness outbreaks, health sector and food sector. This deal other food safety incidents like chemical contaminants, allergens. So if I give the same example of ethylene oxide that will lie on the right hand side, then food sector is being overlapped with another relevant key partners. So I hope the students will be able to correlate who is the other relevant key partner here. In this case of the spices case, obviously it is the Spice Board of India who is the relevant key partner. So since there is no imminent or threat or any adverse incident has been reported, then in case of ethylene oxide, it is purely a risk, a perceived risk right now, which needs to be further analyzed by engaging both food sector as well as Spice Board of India, which the government of India is already doing. So we can see that there could be implication in case it is a foodborne illness outbreak. Health sector and food sector will come together and we try to resolve it or to see how it can be controlled or managed. And in case of any other contaminant like the presence of pesticides, fungicides, or heavy metals, etc., or suppose it is a fish, or and in case we exported some fish out of India, there is a presence of formalin in it, then any complaint or any alert is received through Infosan Secretariat to our National Emergency Contact Point, then obviously Marine Products Export Development Authority, MPDA, will come into picture from the right hand side, and then food sector and MPDA will work together. So I hope this is a very simple flow, and students should remember this, that in case of there is a foodborne illness outbreak, there is a some illness or some death is reported, then health sector and food sector will come into picture. And then
Recording in progress.
in case of any other relevant contaminant in which no imminent death or injury or has been reported, or any adverse health outcome is reported, then purely that body and food safety authority will work together. So but again, this is surrounded by dotted lines, so there is not every situation cannot be so tightly packed. There could be chances that all three sectors might be overlapping. Suppose there is a situation that there was some salmonella contamination, and then it led to the foodborne illness or outbreaks also, and again with salmonella there might be some glass species also. Suppose it is a child food or infant food, then all three sectors will need to work together. So such situations are could be there, so we need to envisage such situations in an open manner. Moving on to this, then there are operational procedures and key elements of food safety emergency response system. There are 5 broad steps basically. One is criteria for consideration of food safety emergency. Another is incident identification. C is emergency response phases. And then we have stand down phase, communication, and post incident review and evaluation. So I'll come to the first phase. It is criteria for consideration of food safety emergency. This step is a very preliminary or very opening step. It involves first of all hazard characterization. One, because there could be any hazard or any hazardous substance in the food, which we need to characterize first. So it can be defined as the determination of significant hazard. Now the term here is the significant hazard should be conducted by the experienced risk assessors, and information derived from food safety monitoring at the national level should be considered to identify level of severity in each food safety incident. Then another option is, another step is magnitude and severity degree of the food safety incident. Here we need to determine how unsafe or what is the level of severity of this incident or hazard. The degree consequences due to the consumption of food or food products reported are taken into account. Here the picture of here the picture takes into account the maximum residue limits, or whether the contaminants can pose an immediate health or life hazard, like that. This will also include potential of risk incident spreading, how fast the risk or the hazard can spread to the others, and distribution route, consumption rate, consumer trends. So basically the scientific risk analysis is carried out in this phase. Now, the magnitude and severity obviously can be restricted and widespread. Suppose an incident is particularly confined to a particular area, then obviously it will be restricted. And in case it is spread to a larger area, it could become widespread also. For example, there was most of the times we have seen that the foodborne illnesses or food safety emergency response systems are to be pressed into service in cases of social gatherings. This is the social gatherings are the most common cause or most common reason for observing food safety emergencies. So in case suppose there is some party and people consumed some same food, and the party the people who attended the same, they fall ill, but that illness or that food safety incident remain confined to only that particular area, so it will be a restricted area hazard or food safety situation. And in case it is spread to the other states also, or if it is a pan India or across country, if it is spread, then it may be called as widespread area incident. Then incident identification, obviously again it involves surveillance. It is essential to identify a food emergency or the initial signs of an emergency unfolding. Local sources will be instrumental during the initial identification, because you can easily correlate that this is the basically the local response team, which is basically called rapid response teams, RRTs, which nowadays under the guidance or under the directions of both Director General of Health Services and FSSAI, they compose of both from food side food safety officer as well as district civil surgeon. So they are the local sources who carry out initial assessment in identifying what could be the most probable cause. Then these local resources would include consumers, local health departments, food retailers, manufacturer, distributors, processor, and producers, and media. Food safety emergency situation shall be declared by FSSAI or Food Safety Coordination Committee after reviewing and analyzing the information collected for food safety incident. So here you must remember that it is not any authority who is empowered to declare any food safety emergency in the country. It is only FSSAI, or in FSSAI specifically Food Safety Coordination Committee, that can declare. Food Safety Coordination Committee is a multi-member body. It constitutes of the representatives of both food sector, health sector, as well as other allied sectors like Spice Board, EPIDA, MPIDA, like that. If the incident is identified as emergency, then a response phase will also be initiated. Obviously, if we identify the incident, then we will go up in the pyramid that we have seen in the first slide, and we will go for an emergency response. Now, emergency response constitutes of three phases basically. One is the alert phase. As a part of, as a responsible, or in fact as a as a member of international community, it is our first step to alert all the relevant stakeholders that such incident has happened, so that and this is being all the civilized or all the reputed countries, they do it in a reciprocal manner. In fact, if there is any incident which is actually a legal or a legally determined incident, then the InfoSense Secretariat will be notified, and other national focal points or national authorities will also be notified that yes, we have come across through from with this situation which constitutes a national emergency. So you can see, if it is an incident which is restricted to a particular area, then there is a known and it is a domestic issue. Suppose there is some marriage party falling ill in a particular district or particular village of Gujarat, then it is not required that we should notify this to Infosan. However, suppose there is some food product which will later on, upon testing, we determined as contaminated with salmonella, was exported to United States or Europe, for example, then it is a obligation upon, it is an international obligation upon us that we should notify it to both Infosan Secretariat for further coordination and to the national emergency contact point in US or UK or any other country where such contaminated consignment was exported. So this is called as alert phase. Then there is action phase. In action phase, Food Safety Coordination Committee will take immediate actions and safety measures to control safety emergency situation. Then stand down phase. This is the third phase. If the risk is mitigated or situation seems to be in control, then advisory should be withdrawn and further advice to the industry and consumer should be issued if necessary. It is the last phase, in fact, in the response phase, but we can easily summarize it as alert phase, action phase, stand down phase. Then we have one of the very significant phases, communication. Why I am specially emphasizing on this phase? It is because sending a clear-cut science-based communication to the public is significantly and almost equally important as compared to the other phases, because sometimes it happens food or illness or health hazards being very emotionally relevant topics or subjects, then every citizen tries to correlate with it. Then there are other elements who try to harp upon or try to feed upon the public fear. So as a part of scientific or food safety community, we need to ensure that there should not be any misconception or perception among the public. The communication should be science based, should be relevant, and should be objective, and above all it should be timely also, so that the unnecessary panic among the public should be avoided. Like ethylene oxide case, there is no immediate danger to the public health, but the way the communication is being projected or was projected was to make it like there is some immediate public health hazard. So such kind of communications can be avoided by issuing timely and objective and science-based communication to all the relevant stakeholders. Broadly, the relevant stakeholders constitute general public, media, people directly affected, authorities, and other professional groups. So in case all such groups are taken into confidence, it is likely that public will understand the cause of the concern, and they will understand, they will have confidence in the national authorities that yes, authorities are taking action. Then post-incident review and evaluation. It includes the review process for responses, activities, communication methodologies, and regulatory procedure to prevent production distribution of implicated food. So we need to ensure as a follow-up action that any production or the contaminated food is duly checked, so that there are no chances of repetition of the same incident. Based on the review, learning lessons from the food safety incidents or emergency gaps may be identified, which could be addressed to improve measures of FSER plan. Also, preparedness for resources and development systems or of structure that can be implemented. So any good action that should be followed by relevant feedback and learned, so that such mistakes are not repeated, and in fact the system can be made more robust, that such kind of food emergencies can be avoided. So as at the beginning of this session, I explained that food safety is a shared responsibility, or it is the responsibility of everyone. So we can see who are the key stakeholders, their roles and responsibilities. First one is government. Government can commit to developing or updating national food safety emergency response plans, strengthen national food control system, increase surveillance, coordination capacities, improve communications with FBOs and the general public. So government obviously has got a clear mandate to ensure that all the administrative system or paraphernalia takes relevant actions in a time bound manner, and carries out surveillance measure from time to time. So if you can recollect, or if you know, we in India, from the health side, we already had integrated disease surveillance program in the country, and which carries out both surveillance for both foodborne and non-foodborne illnesses across the country, right at the primary health center level. So we are in fact going for the technological interventions also through Director General of Health Services, and we are trying to ensure that such data is, with the pool of data which is being generated in the country, is analyzed, and actionable points can be identified to mitigate or to reduce the occurrence of foodborne illnesses, because such illnesses are in fact a national challenge. They lead to further kind of challenges like antimicrobial resistance, etc., apart from causing economic loss and loss of man days. So such kind of national challenges can be addressed through use of this data pool that our IDSP systems are generating. Then another stakeholder is food business. Obviously, food businesses have both private as well as public interest in ensuring that the food they serve to the people or they export to other countries are free from any contamination, because this not only leads to health hazard, but also leads to the economic as well as reputational losses to the country, as well as the company. Now we students can easily correlate the companies who were named by Singapore or Hong Kong in ethylene oxide alerts. They definitely had to suffer a certain amount of reputational loss. So such losses can be avoided if FBO takes due care of good manufacturing practices, good hygiene practices, like that. Then we have another leg, consumer. Obviously, it is not that we should be passive recipient of food. We should be alert, and we should be active and informed enough to understand the risk and to analyze in a proper manner. And instead of believing hearsay, we should try to understand what the official or regulatory bodies are conveying to us, so that we can analyze the situation in a proper manner. Then here I have shared few global technological intervention in food safety emergency response. So at the beginning, as I explained, that there are chances that what you can say, countries prioritizing food safety over food security, sorry, over food safety. So but over the last few decades, the countries have realized that if it is not safe, it is not food. So if it is not food, how can we ensure there is a food security? So we need to take both the aspects of food safety and security together. If it is not safe, it is not food. That is why the focus has now shifted to various food safety response systems also. So first and foremost, I will talk about the Infosan, because it is an international body. It is situated at Geneva. It came into existence in 2004, and at right now 189 countries are its members, and they coordinate through Infosan Secretariat. Infosan facilitates rapid exchange of information during food safety events enabling the implementation of risk management measures to prevent foodborne illnesses and saves life. So we can see that how Infosan is again contributing to the Sustainable Development Goals (SDGs) of United Nations through the ensuring the safe and secure food available throughout the world. Then rapid alert system for food and feed. This is the European Union system. It is again tech driven. In this, the RASF sends alerts to the member EU states and rapidly exchange. It works 24/7, means there is no holiday, there is no waiting period. So RASF is a very active system. And as you can see, there was another news that how many alerts RASF has sent to India. So one thing I would like to share with you is that every RAS alert is taken very seriously in India. It is thoroughly investigated. It is not like that we keep on ignoring. In fact, we investigate and carry out root cause analysis at FBO level. At FBO level, we take the corrective and corrective measures also, and lesson learned are shared with them. In case there are any chances, or in case there is are any lapses reported on the part of food business operator, we from regulator also takes legal action against them. Then another one is ACN. ACN is and one more thing about RAS. In Europe, feed is considered as an extended part of food only. So RAS includes both human food as well as animal feed. This is a broader network, alert and cooperation network. It includes RASF, Assistance and Cooperation Network, and EU Agri-Food Fraud. It is of quite recent origin of 2019. Here it deals with the food fraud network, that is counterfeit food also, and then assistance and cooperation network. This is basically non health hazard incidents also, means such kind of situations you can visualize that what we call as substandard food in the country. Suppose there was a certain juice or certain squash in which there was mandatory requirement of certain percentage of TSS, but in case that was not there, so such cases will fall under the assistance and cooperation network, AAC. Whereas in case of counterfeit products, they will fall under food fraud network. Now students might be curious why these three have come together. So there is a very scientific and administrative rationale behind coming together of these three bodies. First and foremost is that any food which is not of standard quality or is a counterfeit product, there could be chances that that may be unsafe or potentially unsafe for human health. Suppose I found a counterfeit chocolate, then uh, it may not be that it contains certain less amount of cocoa or cocoa butter, but it may be chances that it might have been manufactured in a facility which was contaminated with peanuts. Now it is, for a layman it may sound as a counterfeit product only, but for someone who is allergic to peanuts, it could be a life threatening as a health hazard also. So this is a very progressive approach that all three authorities or bodies come together and work together to ensure that food is safe and of the quality which is desired by the consumer and duly communicated to the consumer. In India, yes, we also have certain technological interventions. One is the IDSP. As I discussed, it is the Integrated Disease Surveillance Program. It carries out surveillance for both foodborne as well as non-foodborne illnesses. And then it communicates or issues alerts also to various state level authorities and food
भैया इथे
authority
कच्ची
also.
गाडी चालू आहे.
Then we have integrated health information platform, IHIP. This is a very interesting portal which has been developed in collaboration with World Health Organization. It monitors food safety incidents, and nowadays we are food authorities working for its integration between these portals with the food safety compliance system, so that the timeline or action period which is required for the authorities to as a follow-up measure is fastened or made more efficient, and that is more of system driven and duly followed up. So the thrust in India for this technological intervention is to break the silos. Means there are chances that everybody or every authority is working in silo in a piecemeal manner, but they may not be aware what the other one is doing. Whereas if we work together, then obviously we will be more than 1 + 1 2. Then we can easily solve, or we can easily have a more robust food emergency response system in the country. So this was basically an overall view of the food safety emergency response system. And one more additional input for the students is that it is not a voluntary thing under the Food Safety Standard Act 2006. It is a mandatory part of it. Food authority is required to carry out risk analysis and coordinate with the DGHS, Director General of Health Services, to ensure that the risk or the chances of foodborne illnesses or outbreaks or emergency situations are minimized. And the good thing is that we have got one of the most progressive legislation in the country and in the world also. I must share the FSS Act is a quite modern and a very science-based act. So that is why the system is improving with the passage of time, and there are certain measures or different practices that are being followed across the country. Suppose, for example, there earlier there we didn't have any food safety emergency response plan in the country. Nowadays, we have a duly notified food safety emergency response plan, which is available on the website. Nowadays, I would like to share with the house is that it is not that any incident of foodborne illnesses goes or is examined in a randomized manner. There is a structured format which has to be duly filled by the food safety officer as well as civil surgeon. So we are taking very scientific and science-based approach right from the root cause analysis to the till to the uh, top of the food safety coordination committee. And then at the back of this we have the food safety risk assessment committee, which continuously analyzes the risk. So I would like to, as the member of scientific fraternity, I would like, or I would urge upon the students also, that this science or the administrative intelligence behind this functioning of food safety emergency response should be communicated to all the stakeholders as far as possible. Means it is not that merely a country has notified X contaminant as a health hazard. We should jump to the conclusion that yes, our food safety system is compromised, or we are suffering, or the safe food is not safe. It is the science-based risk analysis process that needs to be carried out. Uh, a good approach, that is a science-based approach is required, and that will obviously we have a very competent committee of food safety risk assessment committee who carries out this risk analysis. So we should wait patiently. We should listen to the regulator or other bodies to conclude. They are the best judge about the country, that is our India. It is not the external bodies who have just notified us one incident and it will become an emergency situation for us also. So this is the role that I see, that as the members of this food fraternity we can uh, play. Mhm. Then here is I have a very small quiz. I would like participants to please, if they can scan this code, or if they can use QR code to participate in. Samiksha, can you please coordinate with the participants for this quiz? Hello, Samiksha, can you hear me?
Yes, sir, I can hear you.
Yeah.
Participants, hope you are able to scan the QR code. In case anyone's not able to,
I am pasting the link in chat also. So participants can access the quiz from chat box also directly. Samiksha, this quiz is for 15 minutes. Shall we wait for 15 minutes participants to complete?
I think we'll wait for another 5 minutes. It's a very small quiz.
Yeah, yeah,
11:30 we'll
yeah. Then we'll start question and answer.
sure, sure, sir.
Sure.
I hope all the participants are able to access the link or scan the QR code. In case if you are facing any queries, please write to us. So should we discuss the quiz answers first, or should we go for the Q&A first?
Yeah, Samiksha, I think we will discuss questions also because these are the key takeaway points.
Sure, sure.
Yeah. Who declares food emergency situation after reviewing, analyzing the information collected for food safety incidents? So in this case, as we discussed during session also, this is the FSSAI who is the competent authority in the country, not the Infosan. Infosan Secretariat basically extend its cooperation and provides what you can say the as a medium for exchange of information among the country. It is the nationally competent authorities who can declare that whether the incident is an emergency or not. Sorry. Then we move to the next question. It is throughout the course of emergency, it is important to share the relevant information with the following. All four constitute the key stakeholders, and we should target our communication towards all four of them. Then InfoSense Secretariat, this I had also touched upon. If participants listened carefully, this is located at the WHO head office only. This is in Geneva. Then InfoSan came into existence in which year? 2004 is the right answer. Rapid alert system for food and feed is based on farm to fork approach. Yes, it has a farm to fork approach. That's why animal feed is also a part of this. Then in India, FSSAI regulates animal feed and feed products also. Uh, at right now, the answer is no, because animal feed is basically regulated for standardization and other things by the Bureau of Indian Standards. Yes, there are talks going on for inclusion of animal feed as a part of FSSAI regulations, but not so far. Food Safety Coordination Committee is headed by Chief Executive Officer of FSSAI. He basically, being the topmost executive officer of the Food Authority, carries out or coordinates with the other members of the Food Safety Coordination Committee. Then national focal point, national emergency contact point are the same officer. No, they two are not the same officer. In fact, they two are not from the same organization also. National focal point is with the NCDC, National Center for Disease Control, because they take care of epidemiological and clinical part of the foodborne illnesses or food emergency situations. Whereas the national emergency contact point is with the Food Safety Standard Authority of India. He carries out or he coordinates with the InfoSan Secretariat, and in turn further coordinates with the other stakeholders at the national and subnational level. Then an alert and cooperation network is composed of both all the three: RAS, Administrative Assistance and Cooperation Network, and network, FFN, AAC, and RASFF. Then how many countries are member states are there in InfoSan? At present, 189 countries are the members of InfoSan. Ensuring food safety is responsibility of FSSAI only in India? No, the answer is that it is the responsibility of everyone. So ensuring food safety is the responsibility of FSSAI only. It is the wrong statement. Food safety is a shared responsibility. Then who are the stakeholder for an effective food safety emergency response system? Consumer, food business operator, and government. All three are the equally significant or important stakeholders. Then food safety, food emergency and food incidents are the same terms. No, we have seen in the beginning there is a graded pyramid which shows how the response system varies from food incident to food emergency. There must be clear, cognitive, timely, and science-based communication with stakeholders, including public, to manage food safety emergencies. Yes, and the good thing is that all participants have agreed upon it. One Health approach comprises all three: human health, animal health, and environment health. And it is the latest paradigm or latest philosophical thinking of managing the health and health related issues in the world. So this was the end of the quiz. Now I will move upon the final part of the session. It is basically the Q&A session. So Samiksha, will you please moderate the session?
Yes,
And
well,
just a small, just sorry to interrupt you,
sure.
just a small input for the participants. As at the beginning, I thanked AFSTI and CSMB for choosing this topic, and at the same time I would like to share that World Food Safety Day theme for 2024 also is food safety, prepare for the unexpected. So this unexpected here signifies the food incident, food safety emergencies, or foodborne illnesses. So again, over to you, Samiksha. Thank you. Thank you, everyone.
Thank you, sir. Indeed, such crisp and well covered session, sir. Thank you so much for addressing the topic so well. We have a few questions in the chat box. First one is suppose a food contamination occurs in food and the contaminant was salmonella and the food was distributed to schools and students suffer an illness. Then who is to be reported and how should one have an approach in this situation?
Thank you. It's a good question. And most of the time, public or is not aware. Is they are aware of their disease or they are aware of their illness so that they consume contaminated food, but they are not able to decipher where to go, how to report it. So there is a designated officer under FSS Act. He is basically responsible and is the nodal point at the district level. So all the email IDs and contact details of the designated officers are on FSSA website. Such incidents can be reported to the designated officer. At the same time, I must also share that in case you go to any civil surgeon also, he can also report it to the designated officer. We are trying to are working to ensure to make the system so robust or tech driven that any foodborne illness like in the developed world is automatically or through system driven mechanism is reported to the concerned designated officer for further investigation or root cause analysis, whether it is whether the treatment you have taken from a public hospital or through a private hospital. So you can report the such incidents to the concerned designated officers. Thank you.
Thank you. Uh, Another question that was received was there is issue regarding ethylene oxide presence in three Indian spices. Uh, what are your views and what should consumer perceive from this global issue?
See, first of all, we should be able to understand that there are certain things who can be hazard, and then the chances of meeting that hazard qualify them to risk. So we are in fact in our day-to-day daily life, we are surrounded by risk. In fact, driving a car, walking on a slippery slope or a wet floor, all constitute risk. So for public or as a scientific or even in case of ordinary public, we should be able to appreciate that such risk should not lead to the panic. It is a science which is all evolving. Means cell phone are also potential cause of cancers. So they have been recognized as such by the international agencies for research on cancer. So have we stopped using the cell phones? I think no. everybody is comfortable with cell phone, whether it is close to body or it is lying quite far, or but everybody is using it. In a likewise manner, we should not be swayed by one or two reports. At the same time, it is expected that the food regulatory bodies and other stakeholders like Spice Board, they should come out with the clear communication among public that yes, this was the incident reported by some country as per their national regulations, and we are examining or we are dealing with such issues as per our national law. So that is the crux of the thing, that yes, there will always be certain incidents that will be reported bodies. We should not be panicked. At the same time, there should be clear communication among the public, and proper risk analysis and risk management should be communicated to the stakeholder. I hope I was able to communicate something of valuable to the participants in this regard. Thank you, Samiksha.
Certainly, sir. Absolutely, you've been added to our knowledge. Uh, and the question is, sir, that how can technology be leveraged to improve early warning systems in case of food emergencies?
Yes, very, very relevant, and I think one of the very pertinent question. In case we can club our surveillance programs or the things that health sector is doing with the food sector through technological bridges or the APIs, definitely we can have a lot of data, and it is said that data is the oil of modern economy. So at the same time, we can leverage such data and data analytics to analyze such data, to run predictive analysis and to understand where the problem lies. So it's definitely technology can play a very critical role. It can bring efficiencies into our system. It can reduce the information asymmetry. Means it happens sometimes we had some early warnings, but we were not able to correlate things in the system, so we could not take any concrete actions. Such system failures could definitely be avoided by using the technology. Thank you.
Definitely, sir. And one question on the related aspect, sir. Can you provide some examples where such international collaborations have prepared us for an emergency on a global scale in recent times or in past times?
Yes, it is also an interesting question. Means it basically what we can see at judge whether our systems are delivering at national level or at global level. Yes, there are certain instances, especially like swine flu or in avian influenza, because if you see that most of the, in fact, to be precise, around 67, at least two-third of human diseases are now of zoonosis, of zoonotic origin. So there are certain early warnings issued by Infosan that led to alertness among various countries, especially in the East Asian countries where the traditional wet markets are very prominent. And there were instances in which they saved precious human lives and reduce the burden upon the health sector. So yes, Infosan has really worked well, but there are intermittently, like COVID-19, there was overriding health priorities which led to, or health emergencies which led to relegating foodborne illnesses to a certain extent behind. But now, since we are of the pandemic era is over, again Infosan has become very active. Again, they are trying to bring it up to the mark to ensure that we go with the One Health approach. Thank you, Samiksha.
Thank you, sir. Last question for today, sir. Uh, can use of social media platforms and crowdsourcing technologies be instrumental in a food crisis?
Yes, yes. I can't agree more, because you see that this is the social media era. In fact, we are going through social media revolution. We love to have omni-channel communications, and in fact, uh, these are being abused also to increase viewership or to sensationalize issues by fear mongering among public. Means there are both plus and minuses of social media. So why not use these platforms or build capacity upon these platforms to communicate more effectively and more rapidly with the public? Because once Mark Twain said that by the time truth wears shoes, the lies have traveled half of the world. So why not reverse such situations and ensure that before anyone starts peddling fear on social media, we should come up with the more scientific, science-based and rational communication with the public. So I think such agility can be built through social media platforms, and I really appreciate the question and this input. Thank you.
Thank you, sir, for indeed being so patient with the topic that is of such Thank you, sir, indeed, for being so relevant about this whole topic and for giving us such valuable inputs throughout the Q&A, the quiz, and your session. Thank you, sir. Uh, that's all the questions from us today. Any parting messages for the students, sir? Any parting message for the students, sir, as we come to the conclusion?
No, Samiksha, I would just like to say all the best to all the students and to means share with them in case they have any query or any concern or any grievance they can, or any feedback they want to share, they are always welcome. As a member of the same fraternity, I would extend my full cooperation in case you need any assistance or clarification or any. Please feel free to contact me or to AFSTI. We are always there to help you, and I would extend again my thanks to AFSTI, Nilesh Lele sir, Mathur sir, and to Chinmay and Gaurav Agnihotri, and to you, Samiksha, also for holding such a wonderful session and such a wonderful topic. In fact, as I said, that time cannot be more opportune than the present for this topic. So this is the only message, and all the best to all the participants and students. Thank you, Samiksha.
Thank you, sir. With that, we now come to the end of this session. Indeed, a very interesting session, and I would like to request Dr. Asha Sridhar, ma'am, a member of the local executive committee of AFSTI Mumbai chapter, to please present the concluding address for today.
Yeah, thank you so much. First of all, Dr. Vikas Talwar, ji, it was really a very lively and informative session, and thank you so much on behalf of AFSTI Mumbai chapter. I'm sure the students as well as the rest of the people would have been immensely made much more knowledgeable by your session. Also, thank you, Dr. Ritesh, for giving such a wonderful introduction. Samiksha, for making all the arrangements, which was really superb and well coordinated. Just to brief for people who have joined in late, this edu series has been brought in by AFSTI Mumbai chapter and CASMB. We will be bringing in a lot more sessions, which is going to be informative and knowledge sharing, and many more sessions to come. So please do keep in touch with our LinkedIn account. And for those who have not been a part of the AFSTI membership, please do hurry and do take it. Thank you. Thank you so much. And have a good day and a good weekend.
Thank you, ma'am. Thank you.
Thank you.
Yes, thank you, Asha ma'am. And as we close the session, uh, participants, here's your feed for your brain for the next session. We have a very interesting session planned with Dr. Kavita Pandey, the head of Department of Bioanalytical Sciences from the Guru Nanak Khalsa College. Ma'am is a microbiologist and she'll be speaking on the universe within the human microbiota. So please make sure that you register for this session and join us on 25th May, which is 2 weeks from now, for this interesting session. With that, I hope all of you have submitted the feedback form that was shared in the chat box. And I once again thank all of you for joining. And with that, we will now be concluding this session.